La Clínica is a product of a Berkeley student movement who did a needs assessment in Alameda County, and its residents told our students that overwhelmingly the number one issue was the need for a culturally appropriate, linguistically appropriate healthcare services. This was really very much a part of the social justice, part of the Chicano movement, if you will, that was happening at that time.
To me, it was a larger part of what I consider liberation of our community. They were not getting primary care. The ambulances, when they pulled up, they honked 3 times. That meant that it was an indigent patient. So we committed ourselves to access.
They were able to immediately come together and start up a free clinic that they were able to secure funding for pretty quickly so that we were able to institutionalize a lot of our services.
Whether you have insurance or no insurance, that's not an important thing to them. It's they want to serve you. In 1978, my mother was telling me for a couple of weeks now, my stomach is burning. I said, Mom, maybe you should see a doctor. And she said, well, there's a clinic called La Clínica de la Raza. She says they speak Spanish there. They did exploratory surgery. She was pretty advanced in the pancreatic cancer. And Dr. Selby was there by her bedside the whole time. Any decision, he included all of us. Anybody had any questions, we were all very satisfied that whatever he was suggesting was the right thing. And to see my husband feel that trust, that's made us feel good. He had 3 times cancer. And it meant treatments and radiation. And Dr. Bayer was his doctor. And he just made Richard feel so at home and so comfortable.
I saw them take such good care of my dad and my mom, and I remember driving my grandmother there. When I was in my early 20s, I had a nervous breakdown. It just started snowballing from there, losing sleep, not eating right, stressed out, and then you end up not being able to perform at work. I had no idea La Clínica had Casa del Sol, which is the facility that provides counseling and aftercare and ongoing care. The pharmacy worked well together with the psychiatrists at Casa del Sol, the counselors. They helped me fill out paperwork when I needed county help, everything. Otherwise, I wouldn't have put the stress on my mom and dad, so I would have been on the street. Debts that I can never pay them, So grateful for the blessing of them in my life and my family's life.
We help people get insurance or access to Medicaid. Sometimes they don't even know that they're eligible, and our ability to connect them and help them through the paperwork is distinct and important. I'm very proud of the role that we were able to play during this pandemic. Our team really took very seriously the need to vaccinate our community, to test our community, and to do tracing. We were able to secure housing, address food insecurity issues, and other issues that our families were facing during the pandemic. We are very proud of our new facility in Vallejo. It is the only community health center there. We have been able to hire from the community. We're buying from the vendors there. We've been able to partner with the hospitals and with the other systems there to make sure that that community, which has historically been underserved, gets access to the services that they need and deserve. And it's making a difference.
There's just a building of trust that has happened over the years with La Clínica in the community, and it shows.
La Clínica has broken ground to show it can be done in even the most complex of areas. And if it can be done there, it can be done anywhere.
We really thank our sponsors and our donors, and a special shout out to our individual donors who have so many choices, and yet when you pick us, it's such a validation of the work that we do, and we want you to know how much we appreciate it and how much it helps us deliver on our mission to serve those in need and to be able to make a difference in their quality of life.